We have recently opened a new laboratory within the framework of Rostov Medical College, headed by Professor Alexander Tarakanov. You will have a chance to hear him today during the conference. One more good news. Beginning from this year on, all our conferences are streamed online, and you will be able to follow them on the internet and to pay your attention to the questions which are of special interest to you. Now we're being joined by lots of users online. They will also pass on their questions to us. We will be able to answer the questions while we are conducting our roundtables. We have always mentioned that scanner devices and scanner therapy as a technology are the future. Now we can say confidently that this future has arrived. Thank you very much. And one more a bit of information. Tamara Goncharova brought this letter from the United States. I haven't yet opened it. Now I'm unsealing this in front of you. The trademark of RITM scanner is registered in the United States of America. Now I would like to give the floor to our first speaker. It is Alexander Tarakanov.
Dear colleagues, can you hear me well? We are beginning our work program. I would like this program to be democratic, in a democratic situation. I'd like that if you have any question, you should write it down, record it in paper, and then when we have roundtable discussions, we will discuss all your questions. The program is full of problems. There are many reporters. That's why I'm asking all the speakers to follow the schedule in order to respect those people who speak after you. Please show my presentation. Yuri Yurich has already said about that. Starovoytov is our director. We are happy to meet you again. I think that here there are not only professional medical workers, but also other people who are interested in SCENAR. That is why I will talk to you in a language which is understandable to everybody, because our medical terms contains about 5 or 6 foreign languages. If you'll allow me, I will not stand. I'll take my seat and will speak to you about my presentation. At the beginning, I'd like to introduce myself, because sometimes it so happens that a speaker comes out to say something, but nobody knows who he is. My destiny has brought me to Design Bureau RITM in 1999. I'm grateful to my destiny for this. At present, in the Bureau RITM, I'm busy with clinical investigation and biological testings of the most products produced by this Bureau. Besides, my main job is Rostov Medical University. I am head of the Department of Urgent Medical Aid with a course of Medical and Extreme Medicine. Besides my favorite reflexology, which is included also into the SCENAR therapy, my main specialties are clinical pharmacology and anesthesiology and reanimation. Now, let us talk about the main topic of my report. Design Bureau RITM is an enterprise which is busy with not only manufacturing of scanner devices, we can see in this slide that it produces other apparatuses. Design Bureau RITM produces its devices for the whole world. And in order for it to be legal in different countries, it is necessary to pass a very complicated procedure and get an appropriate licensing certificate. You can see in these slides that the OKB production is allowed for medical application in the United States of America, as you understood today, also in Australia, in Canada, in South Africa, in South Korea. I can say confidently that in Russia there is no other enterprise producing medical precise apparatuses which would be so required, which would have such a big demand in other countries. Of course, on the way of introduction of scanner and other devices, there are different obstacles. But all these problems can be solved. For those people who came to our conference for the first time, I just want to remind some trivial things which should bring us to the course of the events of today's conference. What is SCENAR? Actually, I think everybody knows. Please pay attention to the last word. It is not stimulation, it is regulation. When you're talking to the patients and to your colleague, avoid the word stimulation. From the point of view of science, what does the method of transcutaneous stimulation mean? During the last 40 years, there are many of such devices, but SCENAR is different from them. Because it is directed not only to pain relief, but also to give general regulation on all the functional systems of the organism, physiological systems of the organism. It is connected with the fact, but it is not the topic of today's report, but I want to tell you about it a little. When we all were embryos during the prenatal period, we were all formed from 3 embryo petals. And our nervous system, our skin, have common derivation, the common source of derivation. That is why our skin is the screen of everything which is happening inside our organism. At the same time, the place of entrance for any signals which can change the function of our organism. When the functions are changing, it is also possible to have morphological changes. Please pay attention to this slide. Downwards, you can see the scalar impulse, which influences different receptors. In our organism, there are not only usual sense organs react to scalar. We have about 50 systems which are actually organs of sense. Through these organs and through these receptors, which are shown down there, all the information comes to the organism, into the spinal cord and into the great brain. Depending on the place of delivering the entrance of the information, one or another system is switched on. Sometimes, to realize the scalar effect, it is not necessary to activate the great brain. We have checked it with the patients with spinal traumas, with complete destruction of the spinal cord at the level of the neck. Then we can connect the regulations through metasympathetic nervous system, that is inside organs. It doesn't depend on the spinal cord and on the great brain. Of course, it can be done by other devices for transcutaneous stimulation, but scalar impulse is different from the others because it practically has very slow adaptation. I think that today we are going to have more reports on the mechanism of performance of scanner device. I'd like to introduce to you 2 hypotheses of the device performance. The upper hypothesis is what Grinberg's report will be devoted to. But as to the second hypothesis, we have proved it that the scanner therapy starts the activation of radical ferments of our organism, and it makes us more resistant to the external and internal aggression, especially by the radicals of oxygen. I will tell about it later. On the scheme, please pay attention. You can see that while there are changes in the function of membranes, also the functions of channels can change and the functions of receptors can change. That is why if we start anti-radical system, then we invoke, we can say so, reanimation of our organism's membranes. After that, internal and external factors begin to affect us. If we resume what I have said, so we can say it in the following way. The skin is the information field. Scanner therapist is a physician or not a physician, but he should define the zone on the skin which is different from the other zones by different signs. And by effecting on these zones, get definite results. The best way is to explain the effect of scanner therapy on Zakharin and Ged zones. Zakharin is the great Russian therapist who understood, and a great Russian diagnosis physician. And Henry Ged is an English neuropathologist who has proved that the Zakharin zones are metameric. They obey to the physiological laws. Principally, stimulating some zones, we can already influence the functions of the internal organs. This can be seen in this slide. This becomes clear even for scanner therapists who take this device into their hands for the first time. My introduction, which has become too long, is going to be finished. But I'd like to mark also to tell some information about specific peculiarities of the method of transcutaneous stimulation. I will not read about them. You can see them by yourself. Please pay your attention to this part. If we confirm that for scanner treatment, diagnosis is not important, then it is only a game of words. For treatment of some pain, without knowing what disease it is, it will lead to death of the patient, or the method will be proved unuseful. I'm not telling about giving the first aid when the patient needs urgent help. It is very difficult to intercept information for professional medical workers because scanner therapy is a holistic method which has absorbed the European school and the Asian school of study. And their synthesis is sometimes accepted very difficult by orthodoxal medical workers. First of all, it is non-nosological method of treatment. Though I should tell once again that diagnosis only helps scanner therapist. It is not only a mechanism of the disease, it is also the mechanism of recovery, which is called self-genesis. And something that our patients like very much, it is personified treatment, so-called identified treatment. And something that doctors lack all over the world, we can say sincerely, the time which we take to deal with our patient. Scanner does not allow this. So when is it possible and when is it necessary to use SCENAR device? Actually, these are two big directions. Giving urgent medical aid and the urgent first aid. And this is a preventive medicine. I'd like to focus on that surgical pathology is treated by a surgical way, but surgical and preventive aid and the aid after the operations in surgery, to my mind, is also the matter of the future, and it is very effective. A few examples. This is work of OKB RITM and the work of Rostov Medical University. We have tested SCENAR device in 16 cities of Russia. It is shown on the scheme on the left. The experience is about 1,000 calls. There were about 60 to 70 physicians who took part, doctors of urgent ambulance, paramedics. A month ago, I made a report on application of SCENAR on urgent aid on the Russian conference in the online mode. My report lasted about 15 minutes. If it is necessary, and if you wish, I can give you the internet address to see it in YouTube. We have understood that SCENAR can work in all these three situations. These are the international terms. Scoop and run, stay and treat, treat and run. They are the main principles of delivering first medical aid in the world. SCENAR is used in all the three situations. So what are the directions to follow for OKB RITM? At the beginning of my report, I would like to tell you only about some research work which is conducted by OKB RITM. But it seems to me it is better to tell you about this problem from different sides, and now I'm trying to do this. First, production of new technology, new apparatuses, new devices, new stabilimeters, audiometers, and other apparatuses. This is the improvement of technologies which already exist by you, and you know that we often do it for free at the conferences. Besides, we are making independent research. I can tell you that for all independent research, a lot of finance is required. At the conferences, I have been speaking since 2003, and I always ask people to create a foundation for research. But usually nothing happens after that. Besides, we make multi-central research with other enterprises. At the end of this report, I will try to draw you to this research, which we are beginning in Russia. The next direction is the educational direction. Many of our specialists travel all around the world and conduct teaching seminars. Besides, we read lectures in SCENAR therapy. for physicians and paramedics of the Russian ambulance. The direction of research which concern the judicial aspects. New technologies, new devices. I think I shouldn't tell you about other devices today, because generally we have all come here to listen on scanner therapy. One of the last devices is this Super Probe, which has collected all the bad things which have been done during the last few years. From my point of view, it is my personal opinion. This device, of course, requires further development. But the best thing is unlimited. Perfection doesn't know limits. Here you can see different presets for those who is only beginning the scanner therapy. Because for new people it is difficult to understand some modes of work, and OKB Rhythm has decided to make this situation simpler for the users. I'd like to show you some products which you know already, but which are significantly making better the work of scanner therapist who doesn't have complicated and expensive device. This is the device commutators which allow to work with any device, with chance scanners, with scanners of old modifications. Besides, they improve work. They are external electrodes of different kinds. They are also represented here. Of course, we can express different hypotheses on golden electrodes, silver electrodes, electrodes of shungite. It is the mineral which conducts electricity. But I don't have with me a lot of proof. You can see the second product, different computational devices which help to apply new electrodes with old devices. They are adapters. One more thing I'd like to pay your attention to is we have very many external electrodes. They started their existence at about 2003 to 4. They were accepted very aggressively by some scanner therapists, but nowadays there is nobody who doesn't have different electrodes among scanner therapists. Now we will try to classify them. The first group are zone electrodes, zonal. They can be used for mucous membranes, rectal, vaginal, genital, facial, divided facial, combs of different modification. What is common between them? They only work locally. They work on the zone where you imply them. The most important is they can be moved with your help. You can stimulate any zones of your body. The first group also includes point electrodes. They have different shape, but I'd like to focus on the fact that these electrodes really work only when you use not zones but biologically active points. That can be auricle therapy and any other therapy. This is the top level of scanner therapy. It is also usually applied by people who know very well reflexology, electropuncture, electroacupuncture, and so on. The second group of electrodes, you can see that they have two poles. They are divided and dynamic. You can place one electrode, for example, on your extremity, and the other on your forehead or on your arm or to another place. In the right lower corner, there is a divided electrode, which we will present on Saturday in the second half of the day, the fifth diagnosis. It is a random name of diagnosis by the initial and final points of our stimulations. The next group are also external electrodes, but they are static. You stick them to definite places and keep them working. They appeared because I can say it is not a complete scanner therapy. The scanner impulse becomes wide and not dynamic. You simply mark that there is high voltage electric stimulation. Why did they appear? At different places of the Earth, approach to treatment is different. In some countries, physicians think that they do not have to contact with the patient at all. They should simply stick the electrode to him, switch on the device, and things should go by themselves. But everyone has his own opinion to this point. Which is more interesting are static external electrodes, which can be applied at different places of our organism. And you can see that, of course, they are used where small asymmetry is found already. I think you already know what asymmetry means. Once again, I'd like to focus on the fact that anesthetic electrodes, to my mind, are actually weaker than the device itself for searching biologically active zones. OKB rhythm makes independent research. Sometimes the research works are many, sometimes they are not very many. It depends on the finance. It is a complicated procedure. Nowadays in Russia, there is a new order. It was issued this month on scientific research, which makes even more formal the process of research. I think further it will be more difficult to make investigations and tests. It is a painful topic for all of us. Prescription for scanner therapy. I won't focus on the contraindications. Actually, contraindications are all relative. There are no absolute contraindications. What should I focus on is, it is not included into the documents which you receive together with scanner device. Be careful while using scanner device with patients who are apt to thromb formations in the blood vessels. Because any external signal which is received by the organism as a signal of which is recognized from the outside, it starts the system of thromb formation. You know this from your practice. It is stopping often blood bleeding, nose bleeding, bleeding from different cuts, and so on. And today you are going to hear a report of Boris Kulishsky on influence of scanner therapy on live blood. And you will hear the information on the formation of some fibrin filaments, which only says for the fact that the thrombocytes are activated and filaments of fibrines have something to be connected with, and there is something to be formed. To my mind, this is another contraindication, but officially we don't position it so far. Just all of you are also at some risk while you're treating a patient. So, when you open the old manual to scanner, which is 10 years old or 15 years old, you can see there a lot of diseases. In OKB rhythm, now there is research work on changes of prescriptions to scanner therapy. We are taking the way of syndromes and on the way of symptoms. So, one and the same syndrome or symptom can exist by dozens of different diseases. But I think you will soon receive such instructions and such documents. That is why I'd like to mention and to direct your attention to the understanding of some prescriptions which you are using. Here I'm using some photos which I have showed some time before. The first is the general prescription. Is the patient who was treated not by you, but people cannot cure him up to the end. It is impossible to get his complete recovery. In this situation, the help of scanner therapist is sometimes like a magic stick in the hand of Santa Claus. The picture shows that this defect at the lower part of the stomach was 4 months old. It was liposuction operation. For 4 months, this defect couldn't get healed. After using the scanner therapy, only after 1 week, there is a scar which appeared and the defect started to get removed. And the place started to get covered with skin. The stomach hasn't become more beautiful outside, but it was the choice of this lady to do this operation. The next prescription, it is closer to me as for a professional. It's not connected with conventional therapy. This is a person who left for another city, for another country. He became a traveler. Sometimes he can be in the plane or on the train, in a ship. And it is impossible to get professional aid in such situation. Sometimes it can be very tragic. It reminds of a fatalism situation. Here, scanner as first aid in the pocket is very effective. The second thing is the absence of necessary medicines, drugs, especially that many people don't understand quite well which medicines work better or don't work at all. The absence of specialists at the moment. Or it can be a mass amount of patients. You know very well the scanner therapy was used during the earthquake on Haiti. In the American mission, there were two doctors who had four devices, and they gave aid to over 4,000 patients. Also, it was some other places of the earth. It was the second common prescription. The third, scanner therapy is an additional method of fastening the effect of conventional treatment. Major part of the photos which I show you are the photos of our clinical experience, not pictures taken from the internet. The data, which are 11 years old, can have a look at the epithelialization, which is happening in about 2 weeks. This is a patient who had a burn on the feet and face, over 20% of burns. Down on the left, the lady during the treatment, you can see acne vulgaris. This is monotherapy. This is therapy in conventional methods. And this patient was treated by doctoral student of our department of dermatology. The student was from Nigeria. I think he left with scanner for home and he works at home very well. He defended his doctor's thesis on this topic, on scanner therapy. The next prescription is comorbid patients. I'd like to explain you what it means. This is something you face all the time. The patients who have several diseases, several diagnoses. For example, hypertonia and hypertension and diabetes, heart disease and diabetes. Some patients have 4 or 5 diseases. I think in this audience, there is no a single person who doesn't have 1 or 2 diseases. Maybe you don't realize them. What means polypregnosy? When one medicine is not prescribed, it is the situation when a person is prescribed 5 to 10 different medicines. In this situation, scanner therapy is prescribed also. Think of somebody who you treat and to which group you can apply this person. For example, treatment of arthritis. This is my scheme of treatment. I think in other countries it will be not acceptable because in your country there are no such medicines which we have in Russia. No matter how strange it is, please pay attention. I only understood one thing. When we calculate the time of our report, from beginning we should make it twice shorter, because when we have simultaneous translation, it becomes twice longer. That's why, ladies and gentlemen, I'll show you some pictures, some slides, just in a demonstrative way, without explanations. The most significant research to my mind which we made, I'll show you, but the other questions I won't discuss. Other applications of scanner therapy in abdominal pain. There are 4 types of this pain. Besides, you can see all these presentations in the internet. You should not take risks in peritoneal pain and ischemia of the internal organs in the intestines. It is so dangerous that can lead to death of the patient. Wonderful treatment methods when we don't know their cause are alopecia. In such cases, there are many descriptions and a lot of research in Russia. When there are contraindications for conventional treatment, for example, allergic reactions, besides, I can focus on the fact that it is the therapy of choice in pediatric children's treatment, help in oncology, sport medicine, and we can say also many other applications. We propose you one of the tests which exists in OKB RITM, defining the quality of living before and after the treatment. For this purpose, we use this test, SF36. We have it in Russian and in English. There are many parameters. The best is to fill it out together with the patient. But when you have started to treat him, and after you have treated him, after you have tested the patient, you can see the result very well for the patient and for yourself. Because it is necessary to say honestly that major part of the diseases we cannot treat, we cannot cure, but we can improve quality of living. Treatment of animals, you know this. Dogs, cats, elephants, cows. People treat different animals and it is very important. And a few words about those research works which we have made. They all arrived to mutations which is connected with the oxidative stress which we constantly experience. This stress is especially expressed at conferences when we drink alcohol, sleep very bad or very little, we eat food which is not common for us, the time is different, the water is different. This all leads to the fact that that active form of oxygen are trying to do harm to our organs and tissues. First of all, it is DNA. We have conducted such research on healthy men, and I can tell you that you all know very well what means RNA and DNA and what are genes. I will not stop at this. I just tell you that the most suffering element in DNA is the huanin. It is the marker of different probes. It is a marker of mutation. We have seen in our patients, we made 8 procedures during 3 days, and please pay your attention to these 2 columns. And really, the amount of oxidized clonal has been reduced, which means that mutation processes became slower. This gives us, first of all, a big chance for further research, and secondly, a chance for our male patients, if they pass preventive course of scanner therapy, to live about 10-15 years longer. That is what I'm thinking of it. So in 15 years, we meet and we will see who of us men still stays alive. That's what I want to do. A few more words on pain relief. There isn't a single SCENAR therapist who doesn't consider himself to be a big specialist in pain relieving. I can say that it is not so easy. There is a separate topic on this. You can see that there are frequencies lower than 15 Hz, 6, 7 Hz, especially in fluctuating frequency. It is not strengthening, but it is lasting energizing for 5-6 hours. And we will be dealing with this in improvement medicine. Then I continue. Our research has shown this is the border of feelings, the border of pain and bearability of pain. We have studied these characteristics with SCENAR, and we can say that SCENAR can be an analgesimeter. We can evaluate subjectively pain of the patient before treatment and during the treatment. The backbone in our research, it is internal temperature, which shows that during SCENAR therapy, there is normalization of the temperature in different pathologies. You can see this is the loin department of the backbone, from the first to the fifth vertebrae. I will continue because there is no time for this. Definition of pain. This is a personal event, and we should use different scales, subjective scales, to evaluate pain, not simply to say that it is bigger or smaller. I move on. You can read it by yourself. And something I told you about. Now we are planning to have a multicenter research with pains at the lower part of the back. We have developed the protocol. The person who wants to take part in this, please use my email address. We will make an agreement and send you a protocol. In the whole world, there are no proof research in transcutaneous neurostimulation. It is written in some booklets, but they say there is no effect because they didn't use SCENAR devices, they used other devices. If you want to take part in this, it will be a wide multicentral investigation which will be published in different scientific magazines. But this all will be made by one scenario. And a few words more. Who should conduct SCENAR therapy? I don't think it should be offensive to you, but in each country there is its own procedure, its own order of who can and who should treat. Please be careful, be attentive. When you are beginning SCENAR therapy, why should you? Because in our country there is a right for assurance of doctor's mistake. I don't know if it is in your countries. If something happens to a patient, what degree of responsibility is applied on each one of you? It depends on your country. It is a judicial component of our work. We have already had such cases when someone did not take into account contraindications and started to treat patients with psychiatric diagnosis, but it can lead to some unnecessary consequence. Such questions have begun to rise more and more frequently. So I repeat once again, in each country there is its own order. In each country there is its own legacy and medical mistake assurance. In conclusion, I would like to say that SCENAR is a polyclinics and ambulance in the pocket. It is a non-nosological method, self-genesic method, personified, and method which is complementary. Major part of those who are present here use not only SCENAR, but also other methods of treatment in combined. We should accept this. Orthodox of SCENAR therapists are getting lesser and fewer. The questions I'd like to discuss at the round table are presented here. Everybody has them. We can add something to these questions or take something away from this list. But the main mistake of all of us is to believe the authorities. I think Einstein was to say this. I paraphrase him a little bit. So everything I have told you today also can be criticized. You can agree or disagree. Method and technique. This is the favorite word of our SCENAR therapists. I know 300 techniques. But these are all manifestations of one method, and technique makes things more specific. But in order to prove it, it takes some statistics. It is necessary to compare it with another method of treatment. This is what the second report is going to be devoted to. The proving type. I don't ask you to make some such research. It is not your objective. It is our objective. To prove that SCENAR is better than TENS, that SCENAR is better than some medicine. Maybe it is not necessary to prove this. Our main objective is to treat a patient with any means which are effective, which we have at hand. As a joke and seriously, many people got offended with this picture in Marmaris in 2001. But I can see that this is a kind picture, which is good. It is all of our community. We shouldn't look for ourselves here in these portraits. But to my mind, only in this big group of people, team of people, with understanding of everything what we are doing, we will reach good results. And why I believe in it is because we are all here. And thank you very much for your attention.
So the next report is Larisa Klimova. Her report is devoted to the principles of evidence-based medicine. Dear colleagues, let me continue the traditions of the first speaker. I'll be sitting when talking to you. What was the reason for choosing this topic? As Alexander has said, the principles of evidence-based medicine should be present in any kind of treatment which we give to our patients. Up until the second half of the 20th century, all the questions of diagnostics and therapy, solving the issues with diagnostics and therapy, the doctors have always relied on their previous experience, but it has not always led to good results. Why? We are all people. We can be really subjective and partial. It's like the attitude to our children when we see them much better than all the others. Actually, I like several phrases about it. For example, Noah Fabricant has said, as you can see on my slide, that some doctors have been making the same mistakes for over 20 years, and they call them our clinical experience. So you can agree that it's true. There's also one more quotation about it, and basically we can read it as this. The doctor who has seen one clinical case usually says, "This is based on my experience." And the doctor who has seen 2 cases makes a condition that that's based on a series of my observations, but the doctor who has seen it 3 times says, well, it's a common story. At the moment, it's widely accepted over the whole world that it's worldwide.
Встает сакраментальный вопрос. Что важнее? Что важнее? Врачебное мышление и опыт врача. Специфика пациента каждого в отдельности. Или клинические рекомендации, составленные на основании клинических исследований. В настоящее время доказательная медицина, объединив все эти 3 компонента, отвечает на этот вопрос. Что же такое доказательная медицина? Или медицина, основанная на доказательствах? Это подход к медицинской практике, при котором решения о применении профилактических, диагностических, лечебных мероприятий принимаются, исходя из имеющихся доказательств их эффективности и безопасности. И что важно, все это должно использоваться в интересах пациента. Термин этот был предложен впервые в 90-м году группой канадских ученых, ну и он оказался удачным, его сейчас с успехом используют во всем мире. Надо понимать, что доказательная медицина – это не раздел медицины, это подход, инструмент, позволяющий сравнивать разные медицинские манипуляции между собой и определять степень их эффективности. И в настоящее время этот принцип должен использоваться на любом уровне принятия решений. От государственной программы до назначения индивидуальной терапии. В понятие иерархия доказательности входит как бы 2 аспекта, 2 крупных, так сказать, компонента. Это уровень доказательности и класс или градации рекомендаций. Прежде чем перейти и ознакомить тех, кто не совсем в этом вопросе ориентируется, я хочу предложить вам терминологию, потому что этой терминологией пользуются, в принципе, все терапевты, все врачи в мире. И мы должны разговаривать все на одном языке. Часто говорят рандомизированные исследования. Что это такое? Это золотой стандарт получения научных данных о новых методах диагностики и лечения. Пациенты в таких исследованиях делятся на группы. И в каждую группу попадают пациенты совершенно случайным образом. Это и есть рандомизация. В испытываемой группе тестируется новый препарат или метод. В традиционной группе лечение данного заболевания происходит общепринятым образом. В контрольной группе используется плацебо.
Control group, we use the placebo. One more term is control trials. What does it mean? This is the research where we have a control group which we compare other groups too. There's one more term, probably you've heard about it. This is a kind of classical term. This is the blind and double-blind placebo-controlled study. If it's a single-blind study, a patient doesn't know which group he has got into, and he doesn't know anything about what drugs are used to treat him. But the health staff, medical staff, know about it, and sometimes the information can leak, because one of staff members can just tell about it. So the preferred way is a double-blind study, when neither the doctor nor the patient know what kind of treatment the patient receives. For example, what device has been used to treat the patient. There's one more term, which is meta-analysis. Actually, this is statistics of containing all the figures and assessments of this method. So this analysis enables a comparison of different results and makes the research more objective and less partial. Actually, the data can be collected in different ways in different clinics by different doctors, and only when analyzing this numerically we can get objective results. When we talk about the levels of evidence, sometimes we can come across the information that there are 4 levels, sometimes 3, but it doesn't matter. Actually, anyway, the highest reliability is level A. This kind of evidence, we usually get this kind of evidence using large, extended, double-blind, placebo-controlled research. And we get the data from meta-analysis of several randomized controlled trials. So this is actually huge research, usually confirming the effectiveness of this method by numerical values. B, level B, is moderate authenticity. Actually, it's a limited number of patients. It's a medium-sized group. Level C is limited accuracy. This is actually not randomized clinical trials, and the group is also limited. 1, 2, 3 patients without any comparisons, without any control groups. And the last level is D, when the strict scientific evidence is absent, but there is an opinion of some expert who has offered this method. Probably a researcher can suggest the description of some cases. You can meet such kind of articles in journals, in medical journals, when you have the description of some cases, of some experience. Now we are coming to the class of evidence-based recommendations. There are 3 classes, but the second class is divided into 2 groups. So first class. If we say that clinical recommendations refer to first-class recommendations, we can say that they are effective, pleasant, productive, and helpful for the patient. The second class comprises 2 groups. We can say that all the evidence is but it has not enough proofs, enough proof of effectiveness. But there is no proof of harmfulness of this treatment. I hope the third class is not our case. When the evidence says, or all experts agree, that the treatment is not useful, not effective, and in some cases can be even harmful, this is actually the end of any research. It's a bad class for any kind of clinical tests or recommendations. There are international standards which are based on the principles of evidence-based medicine. The most well-known are good medical practice, good clinical practice, and good laboratory practice. The international organizations are Cochrane collaboration. Sometimes in Russia we call it RAIN, collaboration organization. And of course this is World Health Organization. They work using evidence-based medicine principle. There are quite a lot of national organizations. You can see them on the slide. They are from the US, Canada, and in Russia. The center of evidence-based medicine is usually located in central cities where we have medical universities and really big, large-scale medical centers. We have also all Russian scientific societies and groups for cardiologists, for endocrinologists, for oncologists, specialists. You can see the link to the site about Russia, but it's in Russian. There is a translation option, so you can go there and check. Actually, in our bureau, we pay a lot of attention to clinical tests and biological tests. Actually, the first speaker is responsible for this part of our work, who is an academic, Professor Tarakanov. And on this slide, you can see the universities and clinics we work with to perform those clinical tests. Why is it so important? Actually, all new ideas and all new devices, they require medical evidence and clinical evidence. If you try to sell those devices without relying on clinical evidence, sooner or later we can come across a lot of obstacles like standards or kinds of requirements for this or that country. Sooner or later, it will limit the opportunities to sell and to use our devices. And this is a philosophical Russian question. What shall we do in this case? First of all, we need to do some research. Actually, I would call you to join to this research actively. You're welcome to join us in your countries. If you do it in your country locally, it will be easier for you, and there will be more trust for you than to us. What shall you do? So we need to get more evidence and to increase the level of evidence from D Actually, I usually call this level, I feel that this is right, but we need to increase it to a better proof level. If we do it, we'll increase, we'll get a higher class of our proof and evidence. And in any country, any specialist will be comfortably using this device. And basically, it will bring material and moral benefits. I'd like to introduce to you a new site. Actually, it's much better than the previous resource. It has a mobile version. You can use it from your tablets or cell phones. It will be connected and have more links to other sites. It is multilingual, but the most important thing for me is the last point. This is the library. It will be more accessible. You won't need even the registration. We are inviting you to our site. Go there, look at it, compare it, use it. Use it in your sales as the basis, as the evidence base. Thank you very much for your attention.
This report will be delivered by Jakov Grinberg. I don't think he needs much introduction. This report will be delivered by Jakov Grinberg. I don't think he needs much introduction. This report will be delivered by Jakov Grinberg. I don't think he needs much introduction. This report will be delivered by Jakov Grinberg. I don't think he needs much introduction. This report will be delivered by Jakov Grinberg. I don't think he needs much introduction. This report will be delivered by Jakov Grinberg. I don't think he needs much introduction.
Сопровождаем скенер терапию физическим на уровне прибора и организма. Конкретно в этом докладе показана возможность прямого преобразования клетками организма акустической волны и вибраций в электрический ток. Отмечены особые, мы отметим их, особые особенности именно скэнер-терапии при лечении.
Так, подождите, сейчас переводчик не слышит. От накала страстей перегорела электроника.
Физические явления в электронике.
Прослушай, пожалуйста, это.
От накала страстей перегорела электроника.
Не слышу ничего. Я все вижу.
Okay.
Прослушай, пожалуйста. От накала
So the
страстей
report is
перегорела
about
электроника.
physical basics of SCENAR therapy. Yes, we can begin. Demonstrations while interaction of SCENAR devices